Talk about the first three. Your red blood cell count, which is just the number of red blood cells. And again, we're measuring these per microliter of blood. So the top numbers for males, the bottom numbers for females. So these three RBC count, hemoglobin, hematocrit will have different ranges. They vary per lab. Obviously, this is just based on WHO guidelines. Okay, just give you an idea of what the labs would be. So again, we're measuring millions per microliter, just like there's 4,000, 11,000 white blood cells per microliter, 150 to 400,000 platelets per microliter. Well, here we've got millions, about 5 million red blood cells per milliliter. So at least say, okay, about 5 million. But of course, there's the ranges. So hemoglobin. So this is measuring the amount of hemoglobin per volume of blood. This is measuring grams per deciliter, 13 to 18 in males, 11 to 16 in females. Now, hematocrit, we're to explain this is the percentage of blood that's made of red blood cells. So 40 to 54% in males, and then 36 to 48% in females. So roughly you can multiply hemoglobin by 3, and that should roughly give you the hematocrit. But again, hematocrit depends on hydration status. If someone's dehydrated, you have hemoconcentration. You have the same 5 million red blood cells, but now the plasma volume has gotten smaller. Your hematocrit is going to be elevated, although the red blood cell number has not changed. Same thing with, hemodilution. You excessive water intake or you re-expand the plasma volume, will that'll make the hematocrit go down. So it's things to kind of understand. There's another way to calculate hematocrit. I think it's red blood cells, the red blood cell number. So like 5 million, it's like 5 times MCV divided by 10. So you can use that formula as well. So these three things we call your red blood cell indices. Why they call them indices? We're looking at what the red blood cells, what's going on with them specifically, not just the amount. So MCV is the mean corpuscular volume. So mean corpuscular volume, and what this is measuring is the average volume of a red blood cell. So mean cell volume. So this is your average cell volume or size. So it's 80 to 100 femtoliters. Gotta love that measurement. If it's low, you have microcytic red blood cells, small ones. You'd see that in iron deficiency anemia because it's a microcytic anemia. If they're really big, real big red blood cells, that's due to potentially two kinds of anemia we've talked about, and that's your pernicious anemia, where your patient's not absorbing B12, and a folate deficiency. So one or the other, and that would affect DNA synthesis and how we're developing red blood cells, and we use really large red blood cells. That's a macrocytic anemia. Now, MCH, this is the average volume of hemoglobin. So average hemoglobin per red blood cell. So you can see the volume here is 27 to 32 picograms or picograms, very small amount per red blood cell. That's how much hemoglobin you have, the average amount of hemoglobin you have in a red blood cell. The last one, MCHG, is the mean hemoglobin concentration. So mean corpuscular hemoglobin concentration. So it's the percentage of hemoglobin on a red blood cell, and here it's 34% hemoglobin per cell. Just like hematocrit's the percentage of red blood cells per blood, this is the amount of hemoglobin per percentage of a red blood cell. So these red blood cells are covered in hemoglobin. Okay, so 34% around there is the average. So again, you'll see all these on a CBC, but the MCH will tell you some things too. If MCH is low, you have a hypochromic red blood cells. They're pale. So we see that in iron deficiency because it's the most common. A microcytic, the red blood cells are small. Hypochromic, they're pale because we have low hemoglobin, right? Hemoglobin is iron. That's what makes the blood red. So you look at a blood smear, you'll see these smaller, there's normal red blood cells too, but these smaller, pale red blood cells, that's a microcytic hypochromic anemia. Most common causes iron deficiency. Okay, so this affects size, this affects the color, can't say that word, and the percentage of hemoglobin. This last thing here is your RDW, it's your red blood cell distribution width. So basically what this is saying is the variation in RBC size. So this is about 11 to 15%. So we don't want it, so if it's wider than that, I should say, that means you could have really small red blood cells or you could have really big red blood cells because they're usually pretty much the same size, pretty close window. But if you have big ones, well, that widens my RDW. If you have small ones this way, that widens my RDW. So if you had a microcytic anemia like iron deficiency, or you had a macrocytic anemia like pernicious anemia or folate deficiency, both of those would expand your RDW. So after having those examples, think about it. Your red blood cell count, hemoglobin, hematocrit will tell us how much red blood cell mass you have, what's going on there, how much hemoglobin you're making, potentially affecting, a hydration status. You have to kind of take that into an effect. But if these are low, we say our patient's anemic, well, we can go to these red blood cell indices, MCV, MCH, MCHC, and RDW. It can kind of guide us in a direction of what's going on top of looking at a peripheral blood smear. And getting some other labs like checking B12 and folate levels, and looking at kidney function for anemia of chronic kidney disease. There's lots of things that can be done. So understanding these